Hi everyone, it is Danelle and it is October 31st, so happy Halloween. I hope you're having a wonderful and enjoyable Halloween. And it is also the conclusion of Physical Therapy Month, and the last topic up is going to be neck and upper back pain. So for this topic, there are a couple of similarities to back pain, so please feel free to check out that video that I have previously recorded down onto my page, Performance Plus Physical Therapy. And also you can check out a couple of videos that I've done before that addresses and gives you tools that you can use to really relieve pain and pressure in this area if you are having that. Okay? So to dive straight into this, when we're talking about neck pain, about 30% of the population is going to get this. It is a relatively common musculoskeletal disorder that people encounter during some part of their lives. Characteristics of neck pain is really stiffness and tenderness in this area, pain within the shoulder areas, and even down all the way down to the arms and to the hands can happen in really severe situations. In chronic situations or situations that has really kind of escalated or progressed, you may even have pain within the chest area, into the jaw area, and even have pain referring up towards the head and can get headaches with that. So these are things that you want to be aware of. If you're having neck pain, there's a chance that you may feel a lot of fatigue. You may have trouble getting good sleep and getting good rest. You may have trouble turning your head when you're driving, trouble sitting through meetings, trouble lifting if you have kids and you have kids that are getting to be a little bit heavier. When you lift those kids, you may start feeling a lot of strain within the shoulder and the upper neck region. So these are some of the things that you may experience if you are having neck and upper back pain. So neck pain, just like back pain in my previous talk, is really an umbrella term that encompasses a lot of different diagnoses. So things that you may have heard before and that can come under this umbrella term is cervical stenosis. You can have radiculopathy, you can have a herniated disc, you can have a pinched nerve, or you can get into some neurological stuff. You may have thoracic outlet syndrome, cervicogenic headaches. There's lots of fun stuff that kind of sit underneath this umbrella term that can cause you some of the pain that you are having. In terms of what physical therapy can do to address it, you want to get a great orthopedic physical therapist that can address your symptoms and give you a very specific diagnosis, or what we call a differential diagnosis. You get very specific in terms of what your symptoms and your problem is, the better outcome that you will have, and the faster you will be able to recover from whatever is going on with you. Okay, things that we can do to help people with neck pain: we can relieve some of the stiffness, some of the pain. We can start improving your range of motion so you're able to move better. If you can't move that neck and head, you start getting into compensations in the upper thoracic spine in terms of trying to do, if you've had a stiff neck, you can do this thing where your whole body moves. So we really encourage, the return of that function of being able to move your head well, to move your arms well, to hold things and to carry things and lift heavy loads well. And of course, just to go through your regular day. And the more chronic the symptoms are, the more difficult that is to do. So physical therapists and an orthopedic, specifically physical therapist, is going to be able to identify the specific cause and really start working on those muscles to regain your range of motion, get your strength back, and then get you back to the things that you have been missing out on. Sleep, work, lifting your kids. If lifting is your job, if you're a construction worker and lifting heavy stuff is things that you have to do, that sort of lifting. Or even just being able to sit in a car and enjoy a ride home without having to wince in pain every time you look over your shoulder for oncoming traffic. It could be that simple, and can that be complex. So really check me out if you have any questions about your neck pain. If something's been going on for a long time, I'm happy to have a call and talk with you and see how we can kind of get you back to the things that you love doing. Again, check the comments below. I'm going to post a couple of additional video links in there for you to take a look at. And hopefully we can get you back and resolving some of the things that you've been having. And hopefully Halloween and no one scares you that much that you're having any neck pain. So happy Physical Therapy Month, guys. Post the comments below and we'll talk soon.